Oh, the most common complications would be that the patient isn't satisfied. That's also the most common. Some asymmetries may also ensue, but more or less there are very, very few complications if you do the operation correctly, if you plan correctly, and of course if you use an implant that is of high quality. That's why it's very important to have a good partner, and a good partner for me is some product that actually I know it's going to last for 10 years, 15 years, 20 years, or at least so long as the patient is going to want to have the breast augmentation done. Or you go to the surgeon that operated on you. This is actually what makes a good surgeon the best surgeon, to see the complications and to know how to treat the complications. You know, it's not how you do the operation, it's not how you do the sutures. Every seamstress can do a better suture than a surgeon. It's recognizing the complications and treating them accordingly. The worst that any patient can do is not to make a proper surgeon selection. You know, you just go on, I don't know, Instagram or Facebook or wherever, there is a lot of surgeons doing a lot of stuff. So you really, before you choose a surgeon, make sure that he is a board-certified plastic surgeon, that he or she has experience, and that he or she will know how to deal with complications. If, God forbid, any complications happen, you would want that someone that operates on you to know how to handle that. The most difficult situation is when the patient has the expectations too high. You know, the standards too high. She sees some pictures somewhere, I don't know what, and they are photoshopped, and she comes to your office and said, I want to look exactly like that. Although she is totally different. She is, I don't know, she's smaller, larger, fatter, thinner, her breasts are ptotic, and she wants them to look fake. There's just some things that you can't do, even as a plastic surgeon, you know? And you really want to explain to the patient, to the customer, that there are limits to what you can do. And if she or he understands, then you won't have a problem. If they don't understand, or they don't want to listen, or you didn't listen to them, you know, explaining what they actually want, then you will have a problem. You can do the best surgery ever, and if they are not satisfied after the procedure, you didn't do anything. Actually, whatever you prefer, you know, or whatever your surgeon would prefer. I usually do everything in the same procedure, because then it's only one rehabilitation. Because usually people these days want to do everything as fast as possible, go back to work as fast as possible. But if you do two operations, then you need 2 rehabilitation periods, which is sometimes not a problem for some people, but for most people actually that can be a problem. That can be a bit problematic. So it takes a little bit more planning and a little bit more knowledge, but it can be doable. Or the other way around, it's also okay to do it. If they are large enough, yes. If there is only skin hanging, you know, if you have small breasts already, when you lift the breast, you actually make them a little bit smaller because you narrow them. And the narrower they are, the smaller they look on your body. So if you have like an A cup or a very, very small B cup, they will look nice after the procedure, but they will be perhaps a little bit small. So you would want to combine that with an implant or with fat grafting or whatever. And when the breasts are large enough, let's say a C cup or a D cup, it's just enough to lift them. Nothing lasts forever, except the implants. The problem with lifting is that the body will age. You know, your breast, in 10 years, they will be 10 years older. So in 10 years, if you lose a lot of weight, if you gain weight and then you lose it, they will go down again. So I always say that it's like 5 to 10 years, you will probably need something else. Even with breast augmentation and breast pexy. If you do a breast augmentation with an implant and the breast pexy, what will happen is that the implant is going to stay where you put it, but your breast is going to age. So it's going to fall over the implant a little bit. So in, let's say, 10 years, you'll have to do a revisional surgery, which is far smaller than the first one, but you will probably need something, especially if a woman gave birth in the middle and her breasts were enlarged and then go down a little bit again, so the skin will stretch.